This is the tipping point.
No justice, no peace. No justice,
There's no going back.
no justice,
There's no inching forward.
no justice, no peace.
The time is now.
It's about a stand of solidarity versus white versus black, cop versus non-cop. It's humanity versus inhumanity.
Folks are not following the CDC guidelines or our orders. We see spike as high as 506 new cases in one day.
We've got to keep on walking together and marching together and standing together, and together we will win.
Don't stop until it matters that dignity, justice, and equity are a reality for all Black lives.
And a good evening, everyone, and welcome to our virtual NBC6 Voices on our Facebook and YouTube pages. I'm Jawan Strader. Tonight's conversation, protests, and the pandemic and its impact on the Black community, from health to financial hardship to systemic racism. Many of you have been dealing with the impact of all of them. Black businesses have been hit extremely hard in the wake of both. And research out there by the CDC shows that Black Americans are dying of COVID-19 at a higher rate than white Americans. This past week, we've seen fewer protests, but calls for police reform continue across the country as coronavirus cases spike across the country, especially here in Florida. And yesterday, Rashard Brooks, who was shot and killed by police in Atlanta, was laid to rest there. We have a packed interactive show for you tonight. We invite you all out there to take part in this conversation. As many of you know, this is an interactive discussion. So we ask that you leave your comments right here. You can see many of those comments right off to the side there. You can go ahead and voice whatever it is you have to say. If you have a question, let us know what your question is. We will try to get the question in to one of the panelists here joining us tonight. Well, joining us, we start off with Dr. Cheryl Holder from FIU. She's here to talk about what people of color need to do to protect themselves from COVID-19. Wearing a simple face mask may not be enough. Then you may recognize Peter Thomas from the Real Housewives of Atlanta. He owns Bar One on Miami Beach, one of the few Black business owners on South Beach. Mayor Oliver Gilbert, City of Miami Gardens, the largest Black city in the state of Florida. He also is a candidate for Miami-Dade Commissioner. And Greg Millett of amfAR, the Foundation on AIDS Research, recently released a study on the impact of COVID-19 on Black Americans. He is here also to help connect the dots about the coronavirus, economic status, access to health care, and much more. So welcome all of you to Voices and for this interactive show. Well, let's kick things off. Today is a very big day here in Florida because it was announced that a single day record of more than 5,500 coronavirus cases happened here in the state. So let's start off with you, Dr. Holder. What is going on? Why are we seeing the numbers increase here across the state, especially here in South Florida?
Well, we reopened, and it comes after the reopening that I think the messaging on whether you're going to wear your mask, how many people you can be around, where you should be, all the little details weren't as clearly understood. And combined with the messaging that maybe you're okay if you're young, maybe it's okay, you'll be asymptomatic and won't be that bad. And so all over, we were left with, I think, some confusion in what is the best way and what is the role of testing and what's the role of sheltering in place. And so based on that, I think folks took bigger risks than they expected. So Memorial Day came, everybody went out and had a great time. Then the protests, so the combination of workers and the frontline workers, so we get exposed a lot. So when you combine the risk and exposure and not enough protection, you end up with a higher infection rate.
And Mayor Gilbert, you came out just the other day, along with other mayors. You joined with them across Miami-Dade County, talking about the importance of wearing face masks. Why did you do that? Why did you see the importance of doing that?
Well, it's not just face masks, it's all the social distancing concepts and principles. What we think is important, because what we know about the spread of COVID-19 now, which is alarmingly widespread and fast, is that we aren't being disciplined. You can see it all over the place. You can see people out there without masks, people in restaurants working without masks. People stopped taking the precautions that they were taking before, and we saw the disease spread and accelerate. A lot of this is predicated on our inability to be disciplined. And the mask, we think, helps remind people that, we're supposed to be being extra cautious right now. We're not supposed to be. This isn't life pre-COVID. This isn't, the invisible disease out there that could actually kill us, that could be carried by someone who's asymptomatic, didn't magically go away because we opened up businesses. It's still out there. We need to be careful. So the mask actually serves the practical purpose of covering your mouth and your nose, but it also serves the subconscious purpose of actually reminding you that things aren't the way they used to be and that you need to be extra careful.
And something that you said at that meeting, at that press conference, that was hard hitting for so many. Mayor Gilbert, you talked about you were coming from a funeral of someone who had passed away from COVID-19 and the impact on the Black community. How devastating has it been? We know it has been around the world, around the country, but especially in your community, which happens to be the largest Black community in the state of Florida.
It's very difficult because we identify deaths and sickness by numbers on TVs right now. And so we never really accustom ourselves as a community through a community conversation with the actual toll that it's taking on the individual members of our community, that these are people who had families and lives. The young lady who passed away, she was actually the sister of a city council person here in Miami Gardens. That this disease will kill you. And if we accommodate ourselves with that reality, maybe we could actually be a little more cautious. Take a few more precautions. Take those extra steps to protect yourself, your family, and the larger community.
And Greg, let's get to you, because you've done research here with amfAR. You're the vice president. Let's talk about some of that research. What in that research are you seeing when it comes to Black communities and why they're impacted so much?
Sure. Thank you again for the discussion tonight. So the reason that we did our study is because as of mid-May, most of the COVID-19 diagnoses and cases were not disaggregated by race and ethnicity nationally. So we didn't have a good idea of what the national picture was. So what we decided to do is we decided to take a look at those counties that are predominantly African-American across the United States compared to counties that are not. And what we found is that when you have a greater number of residents in a county, you see increasing cases of COVID-19 diagnoses as well as COVID-19 deaths. And actually, when you take a look at some of these counties, you find that these counties only represent 22% of counties in the United States that are disproportionately African-American, but we were still 52% of all cases nationally and 58% of all deaths. So a very small number of counties are what's driving some of the cases and the deaths that we see in our country. And what you hear a lot about is these underlying conditions, diabetes, cardiovascular disease, hypertension, et cetera, and that people with COVID-19 are more likely to have that. And we did see that in disproportionately Black counties, that disproportionately Black counties had these underlying conditions, but that was not driving the cases or the diagnoses. What was driving it were the social determinants of health. So what we found was that unemployment and employment was associated with COVID-19 cases. We found that not having access to healthcare was associated with greater COVID-19 cases in Black counties. We found that density of living, the number of people that you had in your home, was associated with COVID-19 diagnoses. So it's really these social determinants of health, not these underlying conditions, that are driving the cases as well as the deaths among African Americans. And it's not just our study finding that. There are several other studies that have been published after ours that are saying exactly the same thing, that we really need to deal with income inequality and disparities, the fact that many African American communities don't have access to health, because that would drive down some of these disparities, not only with COVID-19, but with many other health conditions as well.
All right, let's get to the impact on Black businesses, and then I want to come back to this as far as the impact on the Black communities when it comes to COVID-19, but the impact on Black businesses out there as well, because it's almost a domino effect that we see happening. And then I want to go back to Mayor Gilbert and his community and the Black businesses impacted. We have Peter Thomas here, who being, first of all, on South Beach as a Black business owner in itself is rare. It's just something you just rarely see nowadays for a number of different reasons, aside from what we're talking about right now. So, Peter, I want to ask you the impact that COVID-19, this pandemic, has had on you and your business, and how have you been able to thrive through it?
Well, I mean, being on South Beach, I didn't really see a big difference between my business and everyone else that's over there. On March 17th of this year, when the order came down that we have to close, we all closed, and no one came out. The street for the first 3 weeks was just no one on the street. Of course, like when, like you don't have a huge corporation and you're like a mom and pop setup, it's difficult because, it's a new business and we live week to week. And when you went from 100%, 100 people coming to the door down to 3 people placing an order on a daily basis, and you have a staff, and you have nothing changed. The rent didn't change, the light bill didn't change, nothing changed. All the bills are the same, but now you're making 2% of what you usually make. So a lot of people didn't survive it. And if you weren't prepared, if you didn't have money put away, in the piggy bank, then 90% of us closed. 90% of us won't reopen. So it was difficult for me being a young Black business on Miami Beach compared to established business that's been over there for the last 20, 25 years.
And Peter, were you forced to cut staff? Did you have to lay off employees? And again, how did you make it through, though?
Well, we definitely were forced to cut staff because then no one could dine in. We were in a business that was doing takeout before COVID. We had to reinvent ourselves and try to make that work. And again, if we didn't have money put away, for the summertime, we usually prepare ourselves for the summertime because summer is naturally slow. So if we didn't have that money put away, I would not be here talking to you now about having my business open.
Amen. And let's go back to Mayor Gilbert on this particular topic, on this issue, because we know there are a number of Black business owners in Miami Gardens. And have you been able to touch base with them or even provide the city, your city, provide them with any type of assistance?
One of the things that we did with a lot of our restaurants, with several of our restaurants, was early on when people were losing their jobs and they were struggling, and before a lot of the feeding programs got up, as a city, we took it upon ourselves to actually go and contract with our local restaurants to provide hot meals to our residents every day. It was our way of actually infusing cash into some of those businesses. We tried to do restaurants like the Lickin' because we understand they have a big staff. We wanted them to be able to keep working. It's been very difficult for these businesses because our economy is predicated so much on service and so much on personal interaction that even if you are a restaurant, Peter's right. You're going from people coming through that door to a much smaller percentage of people who are actually trying to pick up to-go orders or delivery orders. And so it's a struggle. And it's too much of a struggle, really, for local government. It's too much struggle for county government. This is something that properly should be addressed through some of the legislation that was passed through the federal government. The problem with that is a lot of that money isn't actually making it down to the smaller businesses who need it. It's spread out across larger corporations that are structured as independent entities. And so from a systemic perspective, we're going to have a problem with the economy going forward, because what we know about small businesses is they create a large amount of the growth in our economy. They employ a lot of people. We have to find ways as a country to actually get them back on their feet and get them open.
So it sounds like you're saying more needs to be done, Mayor Gilbert, as far as on a federal level.
Look, not a little more, a lot more. Not a little more, a lot more. And we have the capacity to do it. What we know from this pandemic and our ability is, if you think about what people start talking about, somebody said, well, there's no way you can give every American a check. And then we found a way to give every American a check. There's no way you could close down schools. And then we found a way to close down schools. There's no way you could stop the economy and stop traveling. And then we found a way. We can find a way to do whatever we purpose ourselves to do. So the question is, as a country, do we value those just the large corporations, which I got nothing against, who have a lot of reserves, or do we value restaurants that might be like Peter's, who require people to actually come in, require that interaction, who are month to month type as they build their capacity and their wherewithal to be financially stable? What are we going to do as a country? There aren't cities out there who can just help and infuse the amount of cash that those businesses need.
And Dr. Holder, I want to come back over to you now, and I want to talk about the progress. There is some progress being made. Of course, I don't want to make it seem all doom and gloom here, especially with the latest numbers that we've gotten here from the state. But there is progress being made, correct?
Definitely that we've learned a lot about the disease itself in best ways to prevent it. And that's why when we teach the methods that's been proven, it worked for Ebola, it worked for poorer countries, so it can work in our country by social distancing, hand washing, facial protection for everyone, so you can decrease transmission both ways. So that's our goal. And if we do that, we saw that when the older population, and if you look at it, the new highs are in the younger people. Older people are following the guidelines. And we've found a way, what was called cocooning, where we've gotten into the nursing homes, we've gotten to the assisted living facilities, we've gotten the messages to our older patients. So we don't see the spikes in those areas. The areas that we have not done well in is the areas where I feel the messaging has not been as clear and has left the younger folks with a little bit of comfort that it's not so bad. Most people are asymptomatic. So as we can get the messaging improved, I think we're going to see the next group that will be under control. We don't have a good vaccine. We don't have really effective treatment that can say that you're not going to end up on a ventilator. So until we get there, it is imperative that we all do as much to protect ourselves. What we don't know also is that what's going to happen 10, 20, 30 years from now if I've gotten an infection. These are all the unknowns of a new infection like coronavirus, and we don't know this novel coronavirus. So if we can get the message clearer, and it may mean mandating at some point internal, because we know if you're inside and exposed to the virus, there's higher likelihood of transmission. Outdoors is a lot less. But even outdoors, if you can't maintain your 6 feet, then you should wear protection. It's not rocket science. It's basically the stuff gets in your eyes, gets in your nose, gets in your mouth. It'll get into it's very, very tiny particles. So it will get in if you're exposed. So that's why you cover up. If there's nobody around you, like where I am now, no one's here and I'm outside. So this is a safe place. But if you're in an area where you cannot guarantee that, cover up and don't take chances with what could happen to you. And we saw the elderly, we see the 50s and above, they're listening to the guidelines and we're seeing less transmission. Much of the transmission are the frontline workers, the younger people who are out and socializing, and that's where we're seeing the areas now.
And that's what the data is showing, by the way. The data is showing that there are younger people that are being infected with the virus.
Right, but many are also construction workers, landscape workers. There are a lot of workers involved. They're not all just partying. So we're going to need more data to see exactly who is more vulnerable. And that's why we're asking for robust data collection where it takes it beyond race so we can get a better idea, because that might tell us more about transmission and then help guide us, because the businesses do need to stay open. I mean, Black physicians, we're a very small percentage of physicians, and we are also incredibly vulnerable as a business. So, and taking care of our population, we want to keep everyone alive. And we know our population has been sicker. So all COVID has done is accelerate the death. Black folks were dying way earlier than everybody else for centuries. And COVID has just accelerated the problem, amplified the underlying issues that we discussed, the social determinants. So if we do not work on messaging and education and protecting each other, we're going to continue to see the most vulnerable population succumb to a disease, much like they've succumbed to diabetes and other issues, because they've not had the protection in those other diseases either.
And that falls in line, going back to Greg, with a little bit of your research. And you said in your research, quote, greater efforts are needed to eliminate structural racism and address broader social, environmental, economic, and other inequities, end quote. And that's pretty much systemic racism. And pretty much, and we heard from Dr. Holder right there as well, but that's systemic racism in a nutshell. So do you believe that this will help with the disparities in Blacks, not only with COVID-19, but other viruses as well? Because we're not only talking about COVID-19, we're talking about H1N1, we're talking about the flu, we're talking about other viruses that impact Blacks at a higher rate as well.
Absolutely. And that's why we should have known that this was a possibility when this pandemic came around, because 10 years ago with H1N1, we knew that African Americans, Latinos, as well as Native Americans were more likely to get H1N1. And we do know that when you eliminate these structural issues, or if you somehow get them to a lower rate, that you're able to see better disparities and better outcomes. For instance, we know that in the Veterans Administration, there's more equity in healthcare between Blacks and whites as compared to what you see generally in the United States. There's a new paper that is coming out that looked at 6,000 veterans, and they were looking at COVID-19 cases among Black veterans, Latino veterans, and white veterans. And what they found was that Black and Latino veterans were more likely to have COVID-19 cases. But when they looked at deaths, there was no difference by race or ethnicity by deaths. And what's probably happening there is because of better equity of healthcare, better access to healthcare, we're actually seeing just as many deaths for Blacks as well as Latinos as compared to whites. And that's very different than what we're seeing on the outside. So we know that there's these systemic processes that are really problematic and that amplify risk for African Americans. One other thing that I'd like to say as well is that whenever there is a new medical intervention, a new medical issue that we can use to keep people from getting a medical problem or alleviating it, we know that the communities that need it the most are less likely to get it. So for instance, when we first had mammography screenings, we saw that African-American women were far less likely to have access to it, even though African-American women are more likely to die from breast cancer. For HIV, when we finally got new drugs that keep people alive for much longer and make sure that they don't transmit HIV to others, we saw that African-Americans, even though we're more likely to have or get HIV, were far less likely to have access to those drugs. And now today, we see the same thing with COVID testing. We know that African Americans are more likely to test positive for COVID-19, but you can look in many different cities, and there are quite a few studies that have looked at this already, that COVID-19 testing centers are primarily placed in places that are wealthy, that are white, and not Black and brown communities where you would actually get the COVID-19 cases. So we need to make sure that we try and address these structural issues, some of this structural racism, to make sure that we're getting better access to healthcare within our communities and better access to new health innovations.
And I want to move now to a question that we have from a viewer, and then I want to go into the protests that are going on. We haven't even touched on that yet, but I have a question from a viewer here who says, do you feel that people are going to get tested and that they are testing positive and they're then going to work infecting others? And this is a question here by Kevin Arnof. He says, do you feel that people are going to get tested and that they're testing positive and then they're going to go to work infecting others? Who would like to take that? Doctor?
Well, you know, it's hard to say. And that's why we have contact tracing. And one of the issues that should happen and should have been ramped up very quickly is testing. Then we get the contact tracing so we can contain. The only way to know if that's happening is that the contact tracer would then see from the time they're notified, how many places did they go? There's often a 2 to 3 day delay from when you get tested to when you get your results. So until that, I don't know if people are deliberately going to work, but they may be asymptomatic or they may not even be sure. And we know that poor people, if they don't work, they often can, the choices are very difficult. So the contact tracer would be able to answer that question well. Maybe that's happening. And because people will take a chance and often err on the side of saying, you know what, I'm not so bad. I got to work. I got some bills to pay. So that may be happening, but our contact tracing will tell us.
Well, I think there's a problem with that all by itself because the contact tracing is people, they call in your house and they ask you these questions, and people, poor people are not going to be honest about it. You know what I'm saying? So what we do as restaurant owners is that we force our staff to get tested, and we want to see the result behind that. Because I just don't own a restaurant. I actually work there, so I go there every day. And the last thing I want to happen is that one of my staff members that have this thing that need to work, that have no money, okay, is going to come in and not be honest about it. So we need. One of the things that I even put out that text today is that look, everyone has to get tested every week. We need to see it, and I need to see the result behind it. Just at the same way that we take people's temperatures when they walk through the door and make sure they use hand sanitizer. We do the same for our employees. If you have your fever is higher than 100, we're not even letting you in the building. And at the same time, we're being told that it's possible that you have it and don't even show those symptoms.
Yeah.
You know what I'm saying? So it's very difficult as a restaurant owner and restaurant employees on the front line dealing with this thing every day to navigate through this landmine without getting blown up. We don't know what's going to happen any day that we go to work.
Yeah. And Juwan, if I could just add something to that's an important connected dot. We need to do a better job of getting unemployment benefits out. If someone tests positive, whether they know they test positive, because when you take the test, you're supposed to wait anyway. You're not supposed to be out there just, hey, I'm going to hang out and I'm going to do it. You're supposed to be secluding yourself anyway. But there's a lot of pressure on people to actually pay their bills, and a lot of that could be alleviated if we actually got the unemployment system working like it's supposed to. That there's no reason for us to have had the type of backup that we did, because we had a system that was antiquated and couldn't actually service the needs of Floridians. And it puts unnecessary stress and pressure on people to work when they might not be feeling their best. And we want to create an atmosphere where people can actually, they feel open to say, hey, you know what? I don't need to go to work because this is going to be not just dangerous for me and my family, but for the rest of the community. And if we're forcing them to choose between paying their bills and exposure, some people might actually choose paying their bills.
Very good point. Very good point. And something that we have not spoken about, the protest and the impact of the protest. The impact of the protest, not only on maybe COVID potentially spreading, but also the impact of the protest on your business, Peter. The impact of protests in the city of Miami Gardens, Mayor Gilbert. I wanted to know, and Doctor and Greg, I wanted to know the impact of the protest. Of course, we saw thousands hit the streets and hit the pavements and making sure that their voices were heard. But what type of impact did this have on your business, Peter?
Well, it had a direct impact on my business. As soon as I said that we could open on the Wednesday, on the Saturday night when we got a little life and we feel that we'd be able to pay a light bill by Monday, the city came in, code enforcement came in and told us at 9 o'clock we have to shut down because the protest that's what was happening in Miami, even though, we didn't see anything like that happening on Miami Beach. They weren't letting them across the bridge. And that went on for another 2-3 weeks. So we went 100 days of not making any money. It definitely infected, but at the same time, I wasn't really upset about it because we need the protest.
That's right.
We need to be out there marching. I went out there myself marching because what's going on with this COVID-19 kind of take a backseat, which I don't know how that happened. But at the same time, we're marching to be equal. To me, as ridiculous as it sounds, that's why we was out there. We were marching to matter. You know what I'm saying? It was crazy, but, we are all the way at the bottom of everyone's pile, and we just fed up with, the way we're treated, the brutality that's happening from police officers that don't need to be police officers, that's out there with their gun and badge and taking it out on black folks.
I always like to say, Peter, let's say their names. Let's say George Floyd, Breonna Taylor, Ahmaud Arbery, and let's say their names. And Rayshard Brooks, who we talked about earlier.
Yes.
And Mayor Gilbert, something that you did, and it touched me. The reason why it touched me is because some politicians will not say anything. They'll take a backseat and they'll try to play a political role and everything else. You did something that could have been questioned, and it was definitely taking a step by putting up a billboard and embracing the Black Lives Matter movement when some are afraid of embracing it and putting it out there, letting everyone know that you are supporting the Black Lives Matter movement and your city and your community. You didn't have to do that, but why did you do it?
Because sometimes people have an idea of who we're talking about, and we're saying all Black Lives Matter. And so those kids that we put on that billboard, look, we have those are young boys who play on Carroll City Park for a football team called the Golden Army. Their coach is Lee Prince, and he works with these kids all the time. They work with academics for these kids. The point is those parents have the same aspirations for those kids as everyone else. And what we're saying is their life is as valuable as anyone else's. And they shouldn't be afraid. They shouldn't be subject to an implicit bias that could end their life because you thought they were dangerous. Sometimes we need to give a picture, a real picture, put a picture on this for people who might think of Black people as something else in this mind. We have kids just like you. We want these kids to be safe. I want my son to be safe. I want my daughter to be safe. I want my sister to be safe. I want to be able to have the freedoms that America promises to everyone else. Mm-hmm. And it's interesting that we've gotten calls in the office about people want to yell and they want to scream and all lives matter. Well, yeah, all lives do matter. But you know what? We don't have to remind you about everyone else. We have to remind you about Black lives. Mm-hmm. And so, yeah, I have no problem reminding you. The city of Miami Gardens has no problem reminding you. And if people want to have that discussion, we got time. But what we won't do is let you believe that it's okay to put your knee on someone's neck for 8 minutes and 46 seconds and see and hear. You're the soundtrack of a man dying in front of people. Mm-hmm. It just can't be all right. And sometimes we conflate these arguments to say Black Lives Matter. That means you don't value police officers. No, that's crap. Those are false. That's a false choice. Mm-hmm. You can value police officers and want police officers to be the professionals that you pay them to be. Mm-hmm. We want police officers to enforce the laws that equally and fairly for everyone. So this isn't something that the Black community is against police officers. No, this Black community is against people who would indiscriminately and without cause take life in an unjust way. And so that ought not be a Black issue. And that's the one thing, the protest, and I believe that a lot of people did spread COVID-19 during the protest. But can I say that seeing Black people and white people and old people and young people actually standing for the proposition that this was not a Black problem. This is a human problem. This is not a problem that's unique to a discrete part of your population in America, because it should upset every person of good conscience to see and hear this. It should upset every person, not just Black people. And so to see the pictures of people protesting of all ages and all demographics, understanding that this might be that moment where we actually achieve meaningful change.
And Dr. Henderson, I spoke with him a little bit earlier. I don't know if you're familiar with Dr. Armand Henderson. He is the gentleman, the doctor that a few months ago, doing something in the community, giving back, he was pretty much taken into custody briefly and handcuffed. And he was accused of littering when he was actually trying to help the homeless. This is what he had to say earlier. Listen.
And I was racially profiled in front of my home, and I was going to serve the homeless individuals who were out in the community. And the officer that pulled me over or that stopped me in front of my house, he had no mask on. He was inches from my face. This is all the while, people from the police department all the way up to Chief Kalina have tested positive for coronavirus. And so even the people who are supposed to be enforcing the law are doing it disparately towards people of color, as we've seen across the country, but they're not following the law themselves. They're not following protocol themselves and wearing masks and stuff like that. But yes, as you've seen in what happened to me, had I resisted arrest, then I would have given the police officer the ability to exercise his discretion in using use of force.
Now, many of you may remember that story. That's something that made actually national news, because here he is, a black man, and he never once said he was a doctor. And then it came out that he was a doctor. So Dr. Holder, I want to come to you, then I want to come to Greg. But I want to ask you about the Black Lives Matter movement and what it meant to you as a doctor. Now, remember, you're dealing with one crisis, and then you have another crisis happening at the same time. So your thoughts on the whole movement. And then when you hear about Dr. Henderson being allegedly racially profiled.
Yeah, it was a very difficult experience for all physicians. And I know I'm a teacher at the medical school, and this issue came up also for our medical students, because we all felt there was a need for the protest, and we understood the importance of the protest, because what had happened to Mr. Floyd affected everyone. Like Mayor Gilbert said, the humanity of it was just so evident in front of our screen that we had to scream and we had to do something. And that was the tipping point. So understanding that, it still is difficult knowing that we're going to expect this increase in COVID. Now, we don't know the data fully, because unless we know who's getting this infection and where they picked it up, can't say it's always the protest, because a lot of the protest was outside. But for once, the students and everyone said, you know what, it's worth it. They had to speak up. There's a time in everyone's life where you have to make a stand, and they felt it was now. So despite the risk, they would do everything possible to protect themselves. And they also said something really interesting when we talked with our students, and I talked with my patients and people who protested, is that if the government is saying we can open up so businesses can make money, this is basically opening up so we can protest and make a difference in our society. So that is the real goal. That's the mission of what we do as physicians, is really to save lives. And this may save a lot of lives through the protest.
And I want to come back over to you now, Greg, and ask you, as far as the protests are concerned, because some believe that the protests, they were actually increasing or helping to spread COVID. I don't know if you were able to do any research, but were you able to find out any information about that?
Well, I'm a former CDC scientist. I worked at CDC doing epidemiology research for 13 years. One thing that you could see, even with the coverage that you have, that you just showed, most of the protesters were wearing masks. We already know that wearing masks dramatically reduces your chance of either getting or transmitting COVID. And no matter which city that you saw protesters, you saw most of them were wearing masks. So that's a good thing. The protests also happened outside. And we know that you are far less likely to get COVID-19 when you're outdoors as compared to indoors and crammed into a space indoors, particularly with air conditioning or some sort of ventilation that will conduct the virus around in a particular place. So I think that at least what we're seeing here in Washington, D.C., because we had huge protests. My office is only a couple of blocks away from the White House. We had huge protests, but we still see that COVID-19 cases as well as deaths are decreasing in Washington, D.C. New York City also had huge protests, some of the biggest in the nation, but they're also seeing decreases in both COVID-19 cases and deaths. And I think that the fact that most of the protesters, A, wore masks, and B, that these protests took place outside might help in sort of reducing those risks. But I completely agree with what Dr. Henderson said before. I mean, the fact that we've spent months showing that African Americans are at higher risk for COVID-19, but people still felt the need to go out and to protest and to talk about the injustices that they are witnessing day in and day out, speaks volumes about how important this issue is. And then just to tie that back in neatly to see afterwards, after the death of George Floyd, that once they did the autopsy, that they found that he himself had COVID-19 at some point in his life, shows the degree to which how all of this is connected, the social determinants of health, these inequities in health, inequities in social justice, all of them are connected with one another.
And where do we go from here, Mayor Gilbert? And do you see a second wave coming? Because that's the fear.
Well, let me just say first, I couldn't hear anything Greg said. So the sound was completely out. But I think that it's interesting when people ask for a second wave. I'm not completely sure we finished the first one yet. What I do know is if we don't find a way to stop the rapid increase and the positivity rate, what we know is that eventually more people will go to hospital. The more people go to the hospital, the more people will be on ventilators. The more people on ventilators, unfortunately, more people will probably die. We have to stop that. And I hear the narrative that it's younger people and it's having less dramatic effects on them. But most 17 and 18-year-olds that I know live in a house with someone who's older than them, namely their parents. They visit their grandparents. They circulate in a larger community that become dangerous to everyone. And so that's not a reason for us to be less careful because it's less severe disease or has less severe effects on them. That's actually a reason for us to understand that we have an opportunity to wear masks, wash our hands, use hand sanitizer, maintain social distancing principles, and bring this infection rate, this positivity rate back down. Because ultimately, the human cost that comes with this, if we don't pay attention, it's going to be a lot for us to bear and a lot for us to pay.
Amen. Amen to that. Thank you so much, Mayor Gilbert, for that. And before we go, I want to hear one more time from Peter Thomas. I want to hear from you in regards to all those people that may be watching this. What do you have to say to those that may be scared to even eat at a restaurant, let alone come and patronize yours? What do you have to say to them about the efforts being made in order to protect them?
Well, we are everything possible that we can do, from hand sanitizer to wiping down every time someone get up, bleaching all day long, practicing. What makes us so fortunate at Bar One Miami Beach is that we have a huge patio, and we could actually put people not 6 foot apart, but like 12 to 15 feet apart from each other. It worked for us, but at the same time, to be honest with you, if you don't need to go out, then don't, because we have got so many mixed messages in the last 100 years. Last 100 days where they're saying, okay, you definitely need a mask to go in any venue. You might not need it outside. Now you need it outside. It's 6 foot. Now it's 8 foot. Now it's going to be 15 feet by next week. And you still have to now wear it all the time, no matter where you are. I used to laugh at people when I see them in the car driving with the mask, and I said, wait up, maybe they're a Uber driver or something, but now it seems like you just need it all the time. I got fined $50 in my building for being elevated by myself without a mask, so it is critical. We don't have an answer. We watch every day the news from people like yourself to give us the answer, and no one does. No one know when this vaccination is coming around, but at the same time, the economy can't survived the way it was for the first 100 days. We all saw that when the first check went out, and then no small business got it, and then they feel guilty and they approve more money, and then we got it trickle down to us. We all have to survive. If I didn't have to go out, I wouldn't, to be honest with you. I have kids and grandkids that I want to see grow up, and this is the first time I ever see the world just come. Everyone, not black, not white, everyone, come to the same conclusion. Stay in, don't go out. That happened for like 2.5 months until everybody started coming out because people had to get back to work. You know what I'm saying? Talking about the economy, the people who's getting the unemployment check right now and they're getting that extra bonus, you won't see them again until probably the end of August because they don't have to work. Being on Miami Beach, which is less than 1% black, if not 95% of the people that frequent my restaurant is 20 to 30 minutes away. And I must say that I am so proud of them because they knew I exist. They knew I was over there, and they took the chance to come and pick up their food because DoorDash, Uber Eats don't go to their neighborhood. They have to travel half an hour to see me. So I mean, we are finally coming together. We're finally working together. That's why the marching shouldn't stop. We shouldn't stop protesting. We have to keep it going, and we have to make sure that they feel it. And the only way they're going to feel it is if we stop spending our money with them when clearly they don't care about us.
Facts.
You got it. And with that, facts. With that, we're gonna leave it right there. And we really appreciate all of you, Peter Thomas, Mayor Oliver Gilbert, Greg Millett, Dr. Holder. I just lost her. We want to thank all of you for joining in on this very important conversation that we must continue to have. That the coronavirus does not discriminate. It does not discriminate. It doesn't.
Something's happening.
Yeah.
COVID-19.gov, or you can visit NBC Miami and click on the coronavirus tab on the top. We have a whole lot of information there, a lot of helpful information to help all of you that may be watching.
Mr. Gilbert, is that me?
Out there. Thank you all so much for watching. We appreciate you. Have a good evening.
Okay.